We all know COVID-19 as the infectious respiratory illness that infected millions worldwide, but it had an especially negative impact on those with substance use and substance abuse disorders. Subsequently, this community saw an increase in the severity of risks involved, an increase of overdose and overdose deaths, and a decrease in the amount of treatment and prevention available. Luckily, there are steps and recommendations that we can take to better help those that were or currently are struggling due to the effects of COVID. The prevalence of COVID-19 in the substance use and substance abuse community caused multiple negative effects. First, those abusing substances saw a rise in the danger of risks involved with using. While it was still very unsafe to abuse drugs before the pandemic, it is even more dangerous due to the amount of crowded spaces, immunocompromised individuals within the community, and a change in drug supplies. Secondly, the rates of overdoses and overdose deaths were escalating at an alarming rate. Lastly, the amount of drug treatment and prevention resources have lessened because of the increase in those developing substance abuse disorders and those who desperately need help. The risks involved in substance abuse post-COVID have increased the chance of catching COVID, increased overdoses and deaths, and increased the amount and frequency of fentanyl-laced drugs. Before COVID-19 was even discovered, the main worries with substance abuse were the risk of contracting HIV or AIDS with the use of dirty needles, overdoses sometimes resulting in death, and the prevalence of fentanyl-laced drugs. However, after the height of the pandemic, these risks became increasingly severe. Now, those who use drugs in general are more susceptible to contracting COVID. Overdose and overdose deaths were stable before the discovery of COVID-19, but have increased significantly since then. Drug overdoses were occurring pre-pandemic, but were stabilizing between 2017 to about September 2019. Then the pandemic struck, and there were very noticeable increases to the number of overdoses and overdose deaths being documented. The number of overdoses and deaths were bad during the height of the pandemic and still continue to be an issue throughout. In the end, the escalated number of individuals suffering overdoses, sometimes resulting in death, is due to COVID-19 striking this particular population. Those that use substances or suffer from substance abuse disorders saw a dwindling number of treatment options, including, but not limited to, medication management and harm reduction services. Before the negative effects of the pandemic came into play, access to treatment was on the rise for substance abuse programs and other resources. Due to the catastrophic effects the pandemic had on this community, there was an influx of those now suffering with substance abuse. Not only that, but a lot of resources needed to treat these individuals were considered non-essential, and most of these resources were not being prioritized above COVID-19. The options for treatment are decreasing for the individuals plagued by substance abuse disorders, and will continue to do so if resources are going to be taken away and given to prioritize COVID-19. Increasing the amount and availability of resources can reduce the effects the pandemic had on those who struggle with substance use. Some steps that can be taken to combat these increase in risks, overdose and overdose deaths, and lack of treatment is to provide even more resources. Things like expanding the number of treatment and detox centers can prove to be beneficial to those who use substances. Utilizing these centers will also decrease the risks involved for those dosing and can give them a better chance at survival. In conclusion, COVID-19 had a significantly negative impact on the substance abuse and addiction community, even continuing after the fact. So now it is time to start healing and adjusting to prevent further negative regression.